I am Dr. Rajiv Mehta, Consultant Psychiatrist, Sir Gangaram Hospital, New Delhi. ADHD means Attention Deficit Hyperactivity Disorder. That is the full form of ADHD. And it is a most common childhood psychiatric disorder. ADHD basically consists of two things: attention deficit and then hyperactivity disorder. The child will not concentrate in his studies. He will forget the things in the school. He will not be able to complete the things on time. He will make a little concentration mistakes, like he will do subtraction instead of addition. He forgets the things at school. He forgets the things during play. He will not be able to concentrate in the playful activities which require concentration, like chess, ludo, carom. He will be more playing in the outdoor games. Then there is hyperactivity. He will not sit at one place. He will keep on jumping. He will keep on fidgeting. If you make him sit on the one place, he will keep on fidgeting with other things, one thing or the others. At school also he will disturb other children, and he will respond to the questions without even listening to them fully. Then there is impulsivity. He will obstruct between the talks. He will answer very promptly. It will feel like that there is a machine of energy which is being fitted into him. The first one is the history. The history has to be provided or has to be taken from the caregiver. The most important caregiver is the mother. The history, all the questions which I have described earlier are asked from the mother. Different situations are given to the mother and asked how the child reacts in those situations. If there is inattention, lack of concentration and impulsivity in the children, it will come out during the history taking itself. The second part is that we make the child sit along with us and see his behavior, whether he is fidgeting, whether he is more active, whether he is indulging in the talks in between, whether he is responding promptly. Second thing is the mental status examination or observing the children. The third part is scales. Sometimes we use scales to diagnose the severity of ADHD. The few of the childhood disorders which are associated are conduct disorder, in which the child bullies other persons, tell lies for small benefits, involve in sexual activities, bunk classes, disturbs other animals also. So this is conduct disorder. He sets the things on fire. He will cut his toys. Another disorder called nocturnal aneurysm is also associated with ADHD. Oppositional defiant behavior, sibling rivalry. Then there is academic decline, and due to academic decline, in the long run, the person may suffer from other kind of mental disorders like depression, anxiety, inferiority complex. Remember, ADHD is a disease which is a brain dysfunction, and if not treated at time, it will lead to many harmful consequences later in the childhood. So it's better to get treated rather than think that child will improve by himself.